Greetings, everyone. You are now listening to the Brain Geeks. This is Mikyah speaking.
I'm Alyssa.
I'm Icyss.
And I'm Joel.
In today's podcast, we'll be touching upon the neuropsychology of a bipolar disorder.
For those tuning into the podcast for the first time and do not know what these terms mean,
Neuropsychology is the study of the relationship between behavior, emotion, and cognition on one hand, and brain function on the other hand. Neuropsychology focuses both on basic research and on applied clinical research to stimulate systematic investigation into brain behavior relationships and to improve clinical practice. It seeks to communicate the best research and ideas in the field from throughout the world.
The DSM-5 defines bipolar disorder as a group of brain disorders that cause extreme fluctuation in a person's mood, energy, and ability to function.
Neuropsychology is a fascinating topic for me. I became interested in neuropsychology because of having a brother that was clinically diagnosed with ADHD. When I found this out, I actually began to pay attention to his behavior and compared it to the symptoms of the disorder. I just found it mind-blowing how a neuropsychological disorder could affect the behavior of an individual. That was really only the beginning of my fascination. I actually found that bipolar disorder and ADHD are comorbid, which we actually will bring it up later in the podcast.
Neuropsychology is interesting to me because I'm curious about how different neurological disorders affect people, and understanding how the brain functions differently for everyone is intriguing to me. Neuropsychology helps people with various conditions from ADHD to dementia, and it also helps understand how different areas of the brain and its symptoms work together. It also highlights how trauma or physical damage to the brain can cause cognitive changes.
Interested in neuropsychology in regards to how it affects human cognitive decisions, their state of mind, and because of how I personally seen mental illness affect those around me. There are many falsely placed stereotypes regarding several mental illnesses, but one I believe is majorly understood happened to be bipolar disorder, and it affects more people than initially presented to many. A study applied to bipolar disorder can do so much for the conversation, but the more conversations held, and especially this one, the more attention brought to the rising issue. Overall, the symptoms of the disorder and how it works on the brain itself is not a topic that has been discovered with enough depth, and that can be altered. With the references gathered, we can identify the chemistry in the brain involved with bipolar disorder, and what it can lead to, and possibly what else can be affected based on that brain chemistry we're discussing later in the podcast.
I'm interested in the neuropsychology of bipolar disorders because the stigma around this disorder makes us view those who are affected by it evil and emotionally manipulative beings, when that is furthest from the truth. The study of the brain to understand bipolar disorder has increased in recent years because it's a more reliable method of gathering data. The main factors that seem to limit this type of research is the possible drugs that the patients may have taken or been prescribed. This is why when looking for good research on this topic, we made sure to look at the surveys that potential candidates had to take to be eligible for the studies.
To understand bipolar disorder, we will first look at how it affects children.
Children that are diagnosed with bipolar disorder typically display symptoms that most patients with the illness are associated with: depression, fluctuations in mood and behavior, unwanted thoughts, and issues sleeping. But these are at a more severe level and more rapidly as the brain isn't fully developed within the child.
In the article, Pediatric Mania, it discusses how children who exhibit mania are more likely to become adults with extreme bipolar disorder, but it is difficult to diagnose. Childhood onset mania is hard to diagnose because of its overlap with other disorders like ADHD or PTSD. It is also challenging to treat pediatric bipolar disorder because children cannot fully comprehend their disorder and put effective psychiatric practices into place.
I think it is interesting how bipolar disorder symptoms show themselves in children, or instead what we have decided counts as bipolar disorder risks in children. Personally, I feel the only true warning signs of bipolar disorder for children can be if the parent has it, if the parent has worked on their emotional regulation, and if the child is traumatized or experiencing chronic trauma in some way. A comprehensive article released by the BJ Psych Open Journal in 2022, titled Genomic and Neuroimaging Approaches to Bipolar Disorder, discusses that although there has been a lot of research to understand if there's a heritability of it, there has been no conclusive answers. I'd argue that it could be the parent is indirectly teaching the child that this is how they are supposed to act, and this is how the heritability becomes inconclusive.
I would like to egg off on what you said, questioning how are we really supposed to know the signs to look out for when the person in question is a child. According to the article Beyond Genetics, Childhood Affective Trauma and Bipolar Disorder, children tend to pick up on behaviors from people around them. especially between the stages of being a toddler all the way to adolescence, something that we will bring up on a later topic. Children are commonly known to have random outbursts of emotions, mood swings, poor concentration, etc. It would be unrealistic to think that you could diagnose a child with bipolar disorder when they are having trouble regulating their emotions, as most children do. Teenagers are known for their irritability, mood swings, messy sleep schedule, and impulsive behavior. All of these behaviors align with the symptoms of bipolar disorder in adolescence. Therefore, when it comes to therapists diagnosing teenagers, they have to pay close attention to things such as, do the patient have suicidal thoughts, are they committing self-harm, and things of that sort. According to the article Bipolar Disorder in Adolescence from the Oregon Research Institute, 44% of patients with BD have attempted suicide. They have to see if their symptoms are taken to the next level. The part that makes it cross the line to a disorder is when it starts to affect all aspects of their life and they feel as if their actions are outside of their control.
It is difficult to diagnose adolescents with bipolar disorder because at this age, teenagers are learning how to fit into society free of judgment, so they learn how to mask. Masking is the unconscious or conscious hiding of one's symptoms. Teenagers begin masking because at this point in their life, they are vulnerable and their sense of self can be affected by any small judgment.
And many times, yes, mental illnesses will become dismissed by others regarding serious and easily transparent symptoms of bipolar disorder due to this masking, and more as a matter of fact.
Adulthood is the most researched stage of bipolar disorder because the symptoms are most identifiable and the only stage where the participants can actually give consent. They are most identifiable because we are now aware that the behaviors from childhood and adolescence, which can be dismissed as imbalanced hormones, are not as easily explainable from that perspective. Since the patients are adults, they can consent to brain scans. These brain scans have confirmed many hypotheses about bipolar disorder and have brought up further experimental concepts.
Astrocytes are a special glial cell that hover over the entire central nervous system and are essential for many functions in the human body. The factors regarding astrocytes that relate to mental illness and bipolar disorder as a whole is that there are changes to these astrocytes that can span from reversible alterations in gene expression and cell hypertrophy. Reactive astrogliosis is defined as a response of activated astrocytes seen in many neurological diseases. In an article from an Astrocyte Reactivity and Reactive Astrogliosis, Costs and Benefits Journal, written in 2014. With the symptoms being noted, these can alter astrocytes and lead to possible urges and to indulge in negative associated behaviors that have been associated within these studies regarding bipolar disorder.
My mindset has definitely changed after discussing the current research on the topic. There are many more factors that go into the diagnosis, treatment, and definition of bipolar disorder. I find it interesting how many of the symptoms are comorbid with other physical and mental disorders.
Yes, I find it interesting as well. According to the article Adult ADHD and its Comorbidities with a Focus on Bipolar Disorder from the University of Manitoba, people diagnosed with bipolar disorder are affected by the most comorbid psychiatric conditions such as anxiety, depression, and substance abuse. ADHD is actually the most common comorbid with bipolar disorder in both adults and adolescent patients. Symptoms such as impulsivity, inattention, or distractibility are found in both disorders and can make it more difficult to differentiate what the patient should be diagnosed with, whether that be ADHD, bipolar disorder, or even both. According to a relationship between bipolar and ADHD by Geraldine Dexter, who is a licensed mental health counselor, found that ADHD is co-occurring with bipolar disorder in 4.9% of participants, and that someone with ADHD is at a high risk of developing bipolar disorder than someone that does not have ADHD.
Anxiety disorders are the most prevalent comorbid diagnosis in patients with bipolar disorder. Many people with bipolar disorder will suffer from at least one anxiety disorder at some point in their lives. The good news is that the disorders are treatable separately and together. When a person has both conditions, they may find that their anxiety affects the symptoms of their bipolar disorder. This can lead to more mixed manic and depressive episodes. Children with bipolar disorder have the highest rates of comorbid anxiety disorders. Over half of the people with bipolar disorder also have an accompanying anxiety disorder. The co-occurrence between these disorders affect the diagnosis processes and treatments.
Likely suspected, a relation between patients diagnosed with bipolar disorder and possible substance abuse due to the illness had become a prevalent likelihood in patients. With that came many studies testing on various subjects that are all diagnosed and of many testing differing age groups. In a study composed of many authors from Duke University from the Bipolar Disorders Issue 4 journal in 2008, it was discussed that many bipolar patients had a history and lifelong history of abuse of alcohol, cannabis, and to our surprise, cocaine. It had been concluded that substance abuse was a major comorbidity in bipolar patients, and this is because their frontal cortex is wired in a way that does not allow them to easily control their simple urges to find dopamine. Usually our brains will try to stop us from things that we know are bad and have negative effects on us when they're affected by this disorder, and they don't happen to have that same control. This is why they tend to be called risky people. However, this isn't their fault, and good therapy and medications can help them become who they want to be.
An article from the Medicina Buenos Aires journal released in 2022 titled Lithium and Endocrine Dysfunction discusses how the medication typically prescribed to those with bipolar disorder is what creates the metabolic and endocrine system issues that are so commonly seen. Most, if not all, bipolar disorder patients are prescribed lithium because it is a proven antipsychotic that helps to regulate mood swings. This drug affects mostly the thyroid, which can lead to hyperthyroidism, because it causes an overactive thyroid that is important for regulating a person's metabolism. This causes uncontrollable weight gain and could start affecting insulin production, leading to type 2 diabetes. This study brings up the concept that it is not the health habits of the person that causes this specific comorbidity. Instead, it's the very medications given to try to help them that causes it. I'm hoping that in the future there will be better medications for these patients, but for now this is the best option with having to get their blood tested to make sure their thyroid, glucose, and insulin levels are normal. That's to the end of this episode of Brain Geeks. We hope you learned and acknowledged your biases.
As always, our resources are linked in our description. Have a great week and bye Brain Geeks! Goodbye!